All right, back here on the Rochford Files with your host, Andrew Rochford. And even though this is another example of me not normally talking about Republicans, I think in this moment it's worth going in on one. Representative Marjorie Taylor Green of Georgia.
Representative Marjorie Taylor
Waved off concerns over hospitals exceeding capacity due to COVID-19, saying we can't live forever. I've talked to local hospitals here in my district, here in my state. Yes, the waiting rooms get full, but guess what? The waiting rooms are full of all kinds of things, not just COVID, Greene said, but they're seeing about 30% of those numbers being COVID cases. She further said, while the media tries to tell us that hospitals are slam-packed with COVID, that simply isn't the case. Everyone needs to get back down to common sense and remember that, we're human, we can't live forever. We're going to catch all kinds of diseases and illnesses and other viruses. We get hurt sometimes, she continued. Hospitals around the country are struggling as they see a surge of COVID-19 cases fueled by the highly transmittable Delta variant. One hospital, Memorial Health in Chatham County, Georgia, told a local ABC affiliate it had to stop accepting patient transfers from other hospitals. Greene is in the middle of a week-long Twitter suspension after tweeting the vaccines are failing. The Georgia Republican defended her stance that the Food and Drug Administration shouldn't approve a vaccine and that vaccines shouldn't be mandated. Let's not turn it into a authoritarian regime that forces shots into people that don't want it, she said. This article once again exposes how much of hypocrites that your conservatives are when it comes to the issue of, pro-life. They expose that hypocrisy all the time with the fact that they do not care to help babies have their basic needs met. They only care about pro-birth. And they also have this logic of their such irrational belief of religion using God as a justification for enacting bad policy, having bad political beliefs that would overall better benefit the greater good. Like, for example, God doesn't want us to have masks on because that would hide our faces. Or if when you die, when you get sick from COVID, that just meant that, it's probably my time to go or their time to go. It's a thing of fate and you just can't mess with that. Seriously? And this is the problem with Republicans being so unserious about the idea of trying to put measures in place that actually help hospitals not get overfilled. The fact that they're so resistant to mask mandates. We can argue how much mask would help depending on the type of mask you wear. But I'm certain that they do help to some type of degree. And the fact that they've argued for this thing called herd immunity to kick in. But how well is that working when I'm sure that there's people out there now who've been COVID positive twice, and now possibly 3 times, with all these new variants coming out. How's that working out for you? Because what we're seeing right now is it really, just to show you how fragile the hospital system is here in the United States, and this also in a way exposes the fact that we really just don't have enough hospitals, enough doctors, enough nurses, and just not enough of a healthcare industry in general. It's because look how little of a spike it takes to completely fuck up this hospital system. It barely takes a 1% death outbreak rate. That's right, it only takes 1% of severe cases to really strain and screw over our hospitals. And you want to come at me with these arguments about how low well, yes, the death rates aren't really that high, but come on. It only takes think about how little of severe cases it takes to really put a strain on our hospitals. And that's why, if these Republicans were really serious about pro-life, they would be doing things to limit the spread of COVID, such as wearing masks in indoor places as much as possible, social distancing, probably trying to limit your amount of mass gatherings. Because guess what? This Delta variant is still causing some pretty big problems. And the real reason why we should be continuing to take preventive measures on COVID is not so much about deaths, because yes, we should by far most definitely at least have Medicare for all, because that would have prevented at minimum a third of these COVID deaths. But the real reason is so we don't put a strand on our hospitals. Because you know what? The negative snowball effect it's going to have, it's going to prevent people who struggle to get in due to their non-COVID related needs from having the opportunity to get into these hospitals. And this is why when taking safety measures for the greater good need to be about making sure our hospitals can still function. And yes, even if you're not vaccinated and don't want to get vaccinated, we should be making those people do the best they can to stay safe and not be contributors to spreading COVID. But the society as whole is just getting back to the pre-COVID status quo. And that right there is also playing a role in getting people, these hospitals becoming overfilled. And this woman wants to make up this corporate communism, when corporate communism is one of the biggest oxymoron terms that COVID has ever had. Oh man. This is why this is a big issue here. And unfortunately, I'm saying it's bipartisan. In my opinion, both parties are contributing to the problems of overpacking hospitals once again. So even though I'm targeting Marjorie Taylor Greene's rhetoric here, it's because she has very hypocritical views from someone who considers themselves pro-life, and that's why we gotta make sure we argue for the right things here. And that also I advocate, I've adjusted my views on COVID and whatnot, but we gotta make sure that these hospitals aren't having trouble with overcapacity. And this is why, for me, we have to change the argument and the framing to, make it about the hospitals more than about deaths.